those four things in it, the job is not going to be motivating. You cannot motivate somebody to do an idiot's job. Like, the filing clerk, it may be not feasible truly to motivate this person in that job. You can have this person move, right? You can dangle a carrot in front of them, or you can give them a kick from behind, right, to create movement. Okay, but this is only movement. There's not an intrinsic generator in the person. So then somehow or other, if there was a way to build some component in that's where the person's feeling that they have the ability to grow, then you are really taking care of the people that work for you. And whatever it is that's feasible. So in the things that I'm creating in my life, hopefully I'm creating jobs for people actually where they're motivated, truly. And that this is a factor that with my heart, I truly am sensitive to. So I think it's a good idea for us to be bringing in those components.
Yeah. What would you do? Give them a task, one task maybe that they would enjoy to do in addition to the filing. The filing must be done. So you would give them maybe something that they really liked, like from, I don't know what. But
especially if it's a challenge and they can really kind of get up for that job.
It's possible to bring some factors into the job somewhat where, because sometimes a person may not have the time to be treating human beings as human beings at all, but just like perfunctory. They don't really want to be involved too much with the person at all. And I think that's a shame, because these people are going through life, and in some years into the future they'll look back and they'll see what's slavery, and they'll call it wage slavery. That's what they'll call this era. That people were, and they'll kind of want to, how could people have just totally devoted their whole life, every day, day after day, for this wage, right? And it's wage slavery, that's what it is. They'll look back on it. So I think, for those companies really that are advancing themselves, I'm teaching these people this, and I'm saying to them, it's a good idea that these people have the ability to regulate their own time somewhat. If if there's a way for you to employ people in a manner that they're able to regulate their own time, I think that's excellent. That's a standard of excellence that your company has reached. And the people that work for you will love you. The people that work for Edwin, Neil, the Neil Corporation, they love working there. It's in the beauty industry. People are selling on the phone and doing all kinds of things. And Edwin is very particular, and he's like a father in a way to the people that work in the company. If there's something that happens in their family, he is there, and he is caring for these people like they're his children. And that each person that works for him is precious to him, and that he loves this person, and he cares about them intensely, and that he's interested in, human relations. Anyway, we're getting away now from full body calibration. Let's get back to that.
Forward to full body calibration. So although often we're using our eyes and our hand movements and everything else on the body to process, at any time we can process in any mode, looking straight ahead, just looking in one spot. We always have access to all the different ways of processing without our eyes doing anything or our hands doing anything. Sometimes you'll see in the body one brain processing mode inhibiting another. If you see something like a right leg over a left leg, what do you think that might be happening up here that corresponds to what's happening down here? Yes. Putting the feelings forward, like putting the foot down on internal dialogue. And especially if there's more awareness in this foot and this leg, if you just check in and feel which foot you feel more powerfully right now, that will give you an indication of which side is doing the dominant processing. So you can set it up like that. And since Introspection is accessed by...
So just tell us now, why was it that Johnny just did this with his feet, right? That he shifted from his right being out in front to his left being out in front. Why is that, do you think?
Did you hear what I said?
Introspection, which was not the sequential thinking, it's more internal.
Right, okay, so I'll just share with you this. You know, when this leg comes out in front like this, especially when somebody is teaching, generally it's an indication of an auditory lead. The person is leading more with the auditory. When they'll bring this leg out in front, because this leg is involved in internal dialogue. And so now, depending on how the other combination of things are being used, the main thing is that quite possibly Johnny is kind of feeling his right, however his left is out in front. So he's leading with an auditory lead, basically. But that his weight is majorly over his right buttock, even though his left leg is out.
Well, initially it was like this, as I was saying. Now, if you see a body shift to the left like this, and I leaned over like this, you can know that this is the dominant hemisphere, and that I'm being involved in introspection. Whereas this is about expression, because this is what sequences things that we express.
Does everybody notice, did you hear the difference? And notice the difference actually between what was happening over there and what was happening over here with John just then? You notice that there was a little bit of a chopped upness when he was moved over there? Yes. And then the minute that he shifted over here, there was more rhythm and more flow that occurring.
So if you're feeling disassociated from yourself, if you lean to this side, you'll begin to integrate. You'll begin to be more in introspection. Mm-hmm. And more going inward, right, into whatever it was that's there. And what if you wanted to come out of that now? What would you do? Yes, you would shift over to the right, and you would, like contractions of body weight shifts, you know, to the right of the body actually start to stimulate this hemisphere.
I gotta ask, I don't mean to get back on tangent, but in my business I find that I'm very introspective. Very, very, very introspective. I can't shut the damn thing off. And it's a tremendous obstacle in communications. I can't pay attention. I can't communicate. Where I do need to rely on auditory construct, because that precedes vocalizing, right? What I'm saying.
Okay, the thing that you can do is to shape your body. That's what the use of this information is. For thousands of years, this information has been passed down through Tonka paintings. And this information has been correlated with our understanding today of neurology. For thousands of years, in the Vedic tradition, they have been passing down this ability to access state-specific behaviour by what it is that you do with your body. So what I would share with you, Dave, is to move your body round so that you're more presenting from your right side.
Okay.
Shift your weight a little bit so that you're kind of feeling a little bit more your right leg.
Right hand movement.
Right. Use your right hand a little bit more. Okay. And just imagine that you are feeling the energy on the right side of your body somewhat, and that this is the major highway to get where you want to go, right? And there should be a way that you can get there over here too. That you have the ability, matter of fact, to start to use this quadrant as well in a way that is beneficial to you. Anyway, the main thing for the moment, I would say, would be to bring your body consciousness more to the right side and experience going down this major highway to get there, which is the fastest, quickest way. Okay? And when you are feeling confident in your ability literally to go from one state to the next, okay, then you can be anywhere.
So if you notice somebody spending a lot of time leaning to one side or to the other side, you can know what's happening in the brain. And you can know whether they're involved in introspection or expression. Something else that being on one side quite a bit or being on the other side will tell you is the emotional component of a person's experience. This hemisphere mediates aversion. So accessing this hemisphere by being over here actually would sort of help you feel averse. And the opposite,
If the material would lead you to aversion, then absolutely being over here is going to kind of access that more. That's right.
and hanging out over here, you're more likely to be having the emotional feeling of pleasure. Catatonics kind of hang out over here, down in internal dialogue, down here an aversive
Yes.
state like this. To get anybody out of something like that, then you could help them shift their body by going up somewhere, going over, helping them over to the right. Yeah.
So if you're speaking to someone and you're interested in the outcome, it would be to your advantage to stand on their right-hand side.
If you want them to
Slightly
feel that.
right.
Okay, so let's say that somebody, Bruce, is having an abreaction. Okay? You take an abreaction. Let's say that somebody's having an abreaction, okay? An abreaction is that person goes back to something inside themselves and there's trauma there. There's great trauma there. The person starts to become traumatized. And so what would you do? What is something that you could do to sculpt by what you would do with your body? Because part of the component of the competency of getting the practitioner's training is to be able to change state through what it is that you behaviourally do and how you shape things without necessarily having to say anything at all. What could you do to bring this person more into an integrated state?
You run on the right side.
Yes, creating energy on their right side. You could touch the person's hand. If on this hand, if you had rapport with the person, it's possible that you could put your hand on theirs. You could shift your chair a little, and so that you created an energy over here. You could, if you had rapport, you could even have the person shift their body somewhat, so that they're more over here. And
Isn't that going to anchor the trauma?
it's going to bring them into the right hemisphere, because in order for them to be able to have the abreaction, they really need to use their right hemisphere. And if you are blocking their ability to use their right hemisphere by taking them into their left, they're going to be unable to feel the abreaction to the same degree. Even when someone's sick.
Right, and you want them to be able to feel their abreaction so that they can come out of it.
Yeah.
So that they can make a choice to move to the right.
Yeah. So I was with someone over the weekend who went into themselves and really developed an abreaction. Were upset about something, and I had rapport enough to hold this person's hand, and so I sat down a little lower than them, bringing them into this quadrant over here, and I held their hand a little here, and I just gave a little pressure here, okay, because this is my ability to, my colon, which is like what I grasp and I'm able to release. And so this muscle here is very, very much involved in my understanding of what I can contain. And so just putting a little pressure in here, like this, right, is bringing the person more into their left hemisphere, and having their eyes be cast down a little bit more here, and it starts to take them out of the abreaction. You'll notice that someone may be able to easily cry, they may easily be able to cry over here, right? But then if they put the shoulder on, if they put their head on the right shoulder, they wouldn't be able to cry on that side at all. And so if someone's weeping about something, then it's a good idea to have them put their heart out and put their shoulders back. And if you're weeping about something and you can have your heart out and your shoulders back, then I think that's excellent. If you're weeping and you're hunched over like this, I would say this is, yeah.
That's something I've noticed with my own. I've been a real happy person most of my life. In the last 4 or 5 years, been around people saying, yeah, you gotta explore the dark side too. And so noticing how I've learned how to cry, it's like, yeah, I've gotten into, crying like this, and then I've noticed myself really wanting to have my feelings in there. And so I bring the tears up and just cry them up here too.
And there's a different feeling?
Yeah, it's a feeling up here. The feeling has me, and up here, I have feelings.
Okay. Another thing too would be if you can cry about something and your eyes are level, then I would say that whatever it is you're crying about is something which truly is on the level that you're on, not something that's above you,
Right.
and not something that you're passing judgment about, right? Not something that's like way above you, like you're in regression, but something that you have the ability that's equal to you.
David, just a point of interest. When you're talking about somebody who goes into abreaction, just as you may take somebody's body and put it a little bit more out of alignment as opposed to in alignment, would you perhaps work the abreaction a little bit stronger before you make that shift?
Naturally, the person who's in an abreaction, they want to be calm. They generally are wanting to have something settled inside themselves. The brain is naturally wanting this, and basically what's happened is there's an inability to make decision about that. Because there's maybe conflicting beliefs. One belief is overlapping the other, and so there's inability to make decision. Generally, our brain really does want to be able to make decision. So you would naturally do something that was involving a sense that the person was wanting to be moving from that into something else, actually. Yeah.
So there are a number of things that left and right body shift tell us about what's going on. How about forward body shifts and backward body shifts?
Okay.
What do you think that might tell us?
Okay, dissociating, yes.
I do that all the time.
Okay, all right, excellent. Okay, now what about when somebody pushes with the feet? Push with your feet like that. Yes. What about that? This is also dissociation. Pushing away. When you're pushing away with the feet. Right. All right, hold it for a second, Ali. Right, now let your right foot go down and hold your left foot up. When you see this, when you see this occurring, this is internal dialogue on hold. Now let your foot go. And now internal dialogue is free to go again. Now hold your foot up again. Internal dialogue goes on hold. And now put your foot down again.
So remember that.
And internal dialogue is free to flow again.
Make your calls like this.
Yeah, but I stand on one leg with my left leg behind like this.
Do you?
Shut down your
Quite a
leg.
bit. Quite a bit.
You realize that?
Okay.
So if you want to meditate, you could use that technique.
Terry, the main thing is that is internal dialogue. And that internal dialogue is occupying the brain. And that something that's there is on hold. Okay, so it's still internal dialogue. The main thing is that internal dialogue is actually on hold. So when you release that, and actually isn't that interesting, the feeling that happens, inside. Yes. And so what happens, I'm with somebody and I can see them kind of, it's perfectly, everything's okay out here, but you see this kind of happening down here. Really what you see happening down here is happening in the brain. And so the minute that, the person sort of relaxes their foot a little bit, it's more likely that, they're relaxing in the brain as well.
I knew it was going on in the kitchen, my foot was jumping around.
What about chewing gum?
You got some chilling dialogue out there. No, I don't. I have Parkinson's disease, and the medication that I take doesn't always flow properly the right way. It doesn't go sometimes where you need it. And when you do, you get these involuntary movements. I'm sure I've been driving people crazy over the years, so I was watching my feet jump around,
Well, you know something? I know people who would say, they would be shocked if you told them that they had Parkinson's if you saw them doing this, right? Because that's a regular thing. Sometimes somebody is actually moving their legs a lot, okay? And, in a way, sometimes if somebody's doing something else, or whatever it is that they're doing, in fact, or like the cat, licks a place, and then it's maybe got a little bit of a licking disorder, actually, where it takes the hair, the fur, or something like that.
Licking disorder.
So these are all habits, and I'll bet that out here on this swinging log, that some people will manifest Parkinson's out here on this log. You know, the log with stuff. And it was going, whoa, wait a minute, you know. And actually, you know, their legs are going like that, and all of a sudden they go, now, hang on a second. Maybe take a few more steps, you know. So I would say to think about this a little bit more, not so much that there's something that's an ailment, but something much more, well, now what is it that I can do? What is it that I can do actually to bring to me what I want? So that we are not attaching our identity to some behaviour. Are you understanding this? This is very important actually because this is happening out there with all kinds of drug rehabilitation programs and Alcoholics Anonymous, right, where the person is attaching their identity to some behaviour, and this is irrational. And it's
back it up on again.
Okay, the person is attaching their identity to some behaviour. For instance, I mean, there's this path possible. It's possible to get there, you know, through Alcoholics Anonymous, right? It is a path. And they do have some success. I would say that it's bent a little. It's not the straightest path. There's a way for it to be a bit straighter. And I'd say the thing that's making it bent a little bit is that they're asking you to attach your identity to some behaviour. And it would be better off saying, I have some behavioural tendency, or something, that I am a person.
Right. Rather than I am an alcoholic. In the past, I've drunk a lot.
They also use
That's just a behavior.
So they use the same program to identify codependency, drug rehabilitation, everything. Same program, just changing the name.
So anyway, I hope that we know a little better as a result of what we are understanding about brain processes. And anyway, let's get back to full body calibration.
Yeah, let's kind of like wrap this thing up here for a second here. Okay. So Alice, you said that this would be association and this would be dissociation. And what do these words mean? What's going on if there's association or dissociation?
You're getting more.
Very interesting.
Yes. So Alex would be sure to give that person the job. You know, he would be watching this person and seeing this person is like getting over there. They're getting ready to do something. Right? And the person who's kind of leaning back like this, you know, I mean, Alex would really look for the person
That's what you tell them,
over your feet.
they're going to go back.
So if you're talking to somebody and you notice them leaning towards you, you can have an idea that you're on the right track. And if you say something to somebody that, David, maybe you want to make a sale to, and you notice this, then maybe time for something else to get them back leaning forward. Because this is a sign of going towards something that they enjoy.
What advantage is there leaning back? Tell me. What advantage? Not that something is right. Not that something is right. That's not the way to look at this.
Introspection.
Yes. Okay, so that the person is able to do a little bit more in the introspection. What's happening when the person is dissociating? What's the benefit of this? Maybe, that's true. Okay. So somebody said to John just recently that he needs to learn to dissociate. Okay, because dissociation is a wonderful thing. Not that something is right or wrong, no. You know, it's depending on the use of this, the main thing is that when you move back, it means that you have the ability to be able to go from one thing to the next, and actually the movement is helping this. So when a dog is walking along and all of a sudden another dog goes, you know, and so then you notice that your dog's kind of walking along, right, and maybe all of a sudden your dog goes like that, and then it kind of walks off, right, and actually it's dissociated from that. It's been able to just shake that off and just walk. Or let's say that your dog hasn't shaken anything off, and then all of a sudden it sees another dog, and it's going to go like that to this other dog, see? And that's the way that it's able to go from one thing to the next. Well, dissociation, this movement of the body enables a person to go from one thing to the next. When there's a stillness, as in catalepsy, okay, the person's kind of locked in. You know, they're stuck in one state usually. And actually, if you ask the person to be able to move, or if you move yourself, this is the way that you go from one thing to the next, and that the movement is very important in this process. So bringing into the room a candle that's flickering, the flickering light of a candle, this is the analogue of inviting us to be able to dissociate, because the candlelight is the analogue of movement, and that this analogue of movement is inviting us to be able to be in movement ourselves. So having a candle in the room that's flickering light really enables us to be able to dissociate, to be able to reflect on the past and to reflect on the future and to leave the present tense somewhat.
An association or dissociation can be really gross like this, and it can be as subtle as just a minute movement forward or a movement backward with the head. It can be very subtle, and it's nice to pick it up. There's something also about congruity. If you say something and then do a body movement that's congruent, like if you talk about something that you're really looking forward to as you lean forward, then what you say and what you do, you're congruent. And if you see someone talk about what they're really looking forward to do at the same time they do something like this, then maybe there's two different things happening. And you can look for that and see it. Now, I would like to end with the secret to whole brain functioning. I have it here behind my back. This is the direct transmission.
What?
Secret to whole brain functioning is this body movement. Because anything that you do out here downstairs is happening upstairs also. So symmetrical movements involving both hemispheres, both sides of the body, twiddling your thumbs, doing anything like this. You'll notice some things from Tai Chi might pop in here. This is setting up synchronization of the hemispheres and whole brain functioning upstairs.
One of the techniques I use is butterfly. I use butterfly technique.
So this is the secret teaching, and I'd appreciate it if you just kind of keep it to yourselves. Either hand, and it's good to shift.
When I was real little and if I didn't know what to do or was bored, my parents, they said, twiddle your thumbs.
My grandma did that too.
Yeah?
And you know what boy doing it because she told me to.
Well, anyway,
I see you lean back and you talk about avoiding doing that.
Twiddling their thumbs necessarily, right? One day this friend of ours would always, like, if somebody said something to her and it really was something that was absolutely, not something that was involving whole brain functioning, right? She would be she developed this pattern of kind of waving it. Because she could imagine it coming through and then she was kind of waving it. And for about a year she did this. She if somebody said something to her and it really was something that was just like she liked to kind of just disperse, then she would be kind of waving, right? And then one day, I was in the kitchen and I said to her, Renee, her name is, I said, oh Renee, I said, why don't you just take that movement inside? That everybody was seeing her all the time, kind of waving like this, and she did this for a year. And then after a year went by, and finally I said to Renee, I said, oh Renee, I said, why don't you just take that movement inside? And she went, oh. Because actually all of a sudden she realised what it was that people were looking at, every now and then seeing her kind of going like this, what was going on, right? And the thing is that now that you know this, you can imagine that occurring actually in your brain to create a hemisynchronization between both hemispheres, so that each hemisphere becomes in synchronization with the other. And when you are experiencing the essence of genius, this is what's occurring. Your brain is functioning like one neuron. Okay, so we could get into hand calibration, and I think that we're going to have to do that at another time. I think so that you're going to learn this piece first here, and then we'll get into hand calibration as well, what the fingers mean. When you see one finger out in front of the other, what's occurring actually in the brain that enables this. And so this will be a finer type of calibration, and then also where the hand actually, this is meaning something specific in the brain. This is meaning something very specific in the brain. This is meaning something very specific in the brain. So we'll really get much more into where the fingers are pointing and which hand is out in front of the other, and this type of thing. But anyway, for the moment now, I think let's take a 5-minute break, and I'd really appreciate it if everybody could come back here in 7 minutes. Because when we come back in 7 minutes, we'll have someone come out and just share a story with us. And now we'll start how to do it if you start to use some of this full body vibration. Thanks, John. Good stuff. What your limitations are. And then finally, the end result is they tell you what's limiting you. Okay, so then you go away with what it is that's limiting you. Okay, so this is the current medical model at the moment. Now, the orientation that we're using here in whole brain functioning is the very first question that you are asking the person that comes to you is, what is it that you want? And that you are, as much as you can keep the person focused on what it is that they want, you are really moving the person in a streamlined direction, rather than asking them what is wrong, and then them telling you what is wrong, because what's wrong is not what it is that's what they want generally. It's something else usually. So the streamlined way to get there is to ask the person what is it that they want, and have them be focused on that, and then or ask them what their outcome is out of this. And then you're asking them, how does this outcome work? What does it look like? What does it feel? So that you're getting something that's sensory specific. And we're going to be teaching a language model today that's getting things to become more sensory specific and recover lost and deleted information, actually. So, and then your next question is, in your asking yourself is, well, what are the resources that I have? What are the resources that you have to get this? And so the person's focused on this. Let's say the person needs a resourcefulness of creativity. In other words, they need to be creative. Well, then that would be an important resource to be able to solve this situation. You would be in need of anchoring a resource state that's creative, that has a creative component to it. We're going to be learning anchoring today, which is one of the change techniques that we're going to be teaching. So then once you've found out what the resources are to get this, then you're setting something up that's just to do with a feedback loop that's enabling you to know whether you've got this or not. What would this look like, and how would it feel when I have it? And how would life be different now that I have this? This is setting up a feedback loop back into myself that's enabling me to determine whether I have this or not, rather than a diagnosis. You have, which is kind of a dead-end thing, fitting something in there that actually creates feedback back into the system. Okay? So that's an outcome frame. All right? So that now when we're going to ask you what your outcomes are here for this training, for the next days that are to come, what is it that you hope to have achieved at the end of the training? It can be something personal, it can be something professional in the development of self, it can be something that you will have wanted to accomplish, and so that you're going to be using outcome framing to bring this to you. And so it's going to have to satisfy conditions of well-formedness, page 33. It's a need of stating it in the positive. So those people who are excellent in life are asking themselves questions that are bringing to them specific information. It would be no use you asking yourself, why am I this way? Or why don't I have this? Or why can't I get something? A question like this is not going to lead you very far. Those people who are very successful in life have learned to ask themselves questions which lead to information that's valuable, that's usable. So what, when, who, how? What, when, where, who and how are questions that all bring something back to you which is century specific. So stating the question in the positive, framing it positively. Is this outcome that I want ecological? Because to satisfy well-formedness, it's a need of being ecological, and that you are using your intuition, your insight, to sense whether this is ecological or not, and you're taking yourself through the process. Is there any part of me that would object to this? If it's smoking cessation, is smoking cessation ecological for you? So how are you going to be now with your mate at home? That generally in the past maybe you've smoked together or something, and now is it ecological for you to be free now of cigarette smoking? And I would ask, how's it going to be when you sit at home with your mate? Ordinarily in the past this has been an anchor probably for being able to have talk and discuss things, and once the smoking goes, maybe the person's doing something else and there's not harmony in the nest. So is this outcome that you are wanting ecological? And you ask yourself this question.
If the client says it is sound and you in your gut really know it isn't.
Exactly.
What do you do?
So this happened to me the other day. I was counselling with somebody who kind of has been involved in gambling, and what I noticed was that what the person was thinking in what they would do, it was very much like this gambling thing, just like leaving things to chance, rather than me using my brain to bring to me what I want. I'm just totally leaving it up to chance. And so what I noticed was this person said, well, I'm going to quit my job, and then I'll kind of look around for something else. Which is like kind of this gambling thing that's happening even there. And so I knew this was not ecological. And of course, at some level, this person also knew that was not ecological. So you are using your intuitiveness truly to be with the person, and you are sensing that I am the other person. They are me. And I am speaking to myself in the most elegant way that I can, move myself from this position where I am to some other place. Okay, so is it within their control to have this? Because otherwise, what you are doing is not going to work.
And don't you have to say that?
Yes, absolutely. I would say, you are able to use your intuitive self to highlight what is there, and be honest. The more that you can be a reflection like a mirror, the more useful you will be, as a change agent. That you have the ability to reflect back what's occurring. So, and is it testable and demonstratable, this thing that you want? To satisfy a condition of well-formedness, this outcome that you want needs to be something which is tangible, something you can see, something you can feel, something you can hear, something that you can experience. That there would be no use saying, well, I want to be freer, because that's like a gross nominalisation. That's, if you said, I want to be able to relax my breathing and be able to feel like I'm in flow, and then or something, that might be a little bit more of a specific outcome actually, by some date or during something, that would be even more specific. So the desired state must be specific. It would be no use you saying, I want to travel. Would be better off you saying, I would like to travel to France in March next year. That's very specific. Would be no use you saying, I want to finish tasks on time, because that's not specific. Specific would be, I am going to hold an image of one task in my head long enough to be able to complete that task before I entertain another. So there's elements out here which we are watching you to see to what degree you have the ability to focus on the task at hand, and what is occurring. Have you got programs running that's creating distraction? So it would be no use you saying, I want to be able to make decisions, because that's not specific enough. Specific would be, I would like to be able to have the sensory experience enough to be able to make decisions. So the decision making is based on your sensory experience. Okay, so this outcome that you are thinking needs to be specific. All right. So now, whenever somebody comes to you, you can use this information truly to create a well-formed outcome with the person. All right. So now, take 10 minutes out now to come up with an outcome. Maybe you have a couple of outcomes, and you're going to. Okay. So basically, I'd like to explain what an anchor is, and the reason for an anchor is that you can get a handle on some state, so that all you need to do is to use a voice tone, for instance, if that was the anchor, like a soft, low voice tone, and that this hypnotic state got access to this slow, soft voice tone, and so that whenever this voice tone was used, people started to go more into themselves. This would be an anchor for this state. Or whenever it is that you see a photograph of something that's a reminder of some feeling at the time, that picture is an anchor for some state. In other words, the picture is getting a handle on some state inside. So, for instance, we could elicit a resourceful state, and let's say there's a need for creativity to be there. So the person could think back to some moment in the past when they were creative, and they could feel this creativity, and you could ask them, what does this feel like? What does it sound like to you inside? And when you are seeing a robust state of this creative self, then you could, just in that moment that the state peaks, that you're seeing the state peak, now we're going to learn anchoring through the kinesthetic self. And the main thing is that you can use this technique of anchoring with other things that you're doing in the other senses. The main thing is that we're going to teach it, the simplest way to teach this is to teach it through the kinesthetic self, that you're going to ask somebody where they would like to have that anchored, and then you're going to touch that place, okay, in the same way that you anchored it, and it will re-access that state. The reason why it's great that we're able to do this is because then the person can go and be doing something else, and then whenever you would come back and fire off that anchor, it's acting like a tuning fork or shortening the aerial on a radio, tuning in a specific frequency. So anchoring basically is classical conditioning. When the response, when the stimulus is given, we get a response. So it's a pairing of a stimulus with a response. And the main thing is that there's a principle underneath this that's very valuable in everything that you do. So if I was to go over and shake that hand like this, like that, right? And whenever anybody's ever shaken Dave's hand like that, okay, this is the kinesthetic anchor of excellence. It's a handshake which is kinesthetic, and whenever anybody's ever shaken Dave's hand like that before, it's always because he's done a good job, and it's a kinesthetic anchor of excellence. So now when I shake Dave's hand like this, there's a sense of feeling excellent inside. Or I came up behind Annie the other day, and I came up behind her around like this. So this is certainly an anchor of support. And if I was placing an anchor and I touched Christiane's back here, right? Now that's probably not a good place to anchor something too much, okay? Because when Christiane was small, this is probably the area actually where she was really kind of pushed along. Come on, like this, right? So when you choose a way to anchor, it's a good idea that there isn't any competition with other types of things that are stored there. So that you're picking a place, in fact, that's distinct. It's not going to compete with other things that are there. Now the timing of it's very important. So if we were going to access a resourceful state, and you've asked the person, where would you like me to anchor this? And the person said, you can put that, on my knee, or I'll shake your hand as this feeling comes on, and you will set that up with the person. Because the reason why is because just as the state peaks, just before it peaks, okay, that's when you're going to anchor it. So now you're watching for a behavioural manifestation of that internal response, and when you're anchoring it. So you're using your eyes to sense when it is that you have the state. So let's say that we were going for a robust state of pleasure and resourcefulness. I might ask this, when was the last time you just laughed so hard you fell down on the floor, you were laughing so hard? And I watch the person smile. Just as the person smiles, I fire off the anchor, okay? So that you can stack anchors this way, okay? So you can build a resource stack. So then when you just shake the person's hand, you can test your work, and you can see that you fire off the hand, and you can see that it's bringing back the memory.